So we're arriving at Asylee Women Enterprise. This is the front entrance. It actually used to be an old convent.
So we work with asylum seekers and foreign-born survivors of human trafficking. So they're ineligible for things like Medicaid, often ineligible for private health insurance. However, they, like everyone, have a range of medical needs, and many of them have experienced significant trauma. So accessing things like therapy, accessing physical health care is really critical to their ability to stabilize, to begin to really rebuild their lives here.
Program development as part of my role can mean a host of different things. A lot of it has to do with kind of identifying needs that our clients have related to healthcare and seeing how we can facilitate that and improve it for them. Also, I do qualitative research with folks who are in the SOT or Survivors of Torture program here at AWE. And so my research is to interview people who've gotten the collaborative care model compared to folks who just were getting healthcare in the community and trying to understand if there are any strengths or ways we can improve our programming. I think in the past few years or decades at Johns Hopkins, there's more of an emphasis in community involvement and partnership. There are so many community projects and research. I think it's a pretty common experience for medical students to reach out to their academic mentor and say, you know, I'm looking to get involved in X. And very easily, your mentor can connect you to someone, which I think is pretty unique here.
When I started, we weren't yet partnering with Hopkins, and looking back, it's absolutely transformed the work that we've been able to do. We look at the needs of our clients, try to address them holistically, and healthcare was such a big gap. It was this huge unmet need, this obstacle that prevented our clients from truly stabilizing, and so that partnership has just been immensely valuable.
People sometimes focus on the services that are provided, but I think it is really hard to encapsulate to someone who hasn't worked here in this space how much the staff and people working here are really also benefiting and just growing as people from everyone we get to interact with. There's just so much sharing that goes on in this space, whether it's preparing food for one another, sharing traditions in people's home countries. It's just very special, and so the clients have been so generous with their time and with their stories, and it's definitely enriched my day-to-day.